Welcome back to my channel, Pharma Training Solution. Today I'll be talking about code of conduct, decision making, and ethical dilemmas. Of course, always in practice we have to know this. Now, the code of conduct sets out the core principles in accordance with which the pharmacy professionals must act and by which they will be judged by society during the provision of their professional services. Of course, this ensures that the person who is employing the services of a pharmacy professional can expect or encounter the highest professional standards during the provision of pharmacy care. What are the core codes of conduct? Make your patients your first concern. Don't think about money, but patients should be your first concern. Should honor and dignify the pharmacy profession. Ensure good relationship with patients and clients, and of course ensure good relationship with other pharmacy professionals and other healthcare providers. Conduct yourself in an appropriate manner. Are you a professional who is slapping professionals at work? Are you drinking? Are you what? Should maintain competence through attending CPDs. Must ensure privacy and confidentiality. Ensure well-being of the community. You have regard for human life. Don't participate in anything that causes harm to human life. Promote rational use of drugs and take responsibility for any actions taken. Decision making is important during solving of the problems in order to determine the appropriate action. Now, of course, decision making is made through patient assessment, during interaction with other healthcare members, of course, that interaction, during filling of prescription, documentation, counseling, and personal education, and follow up, and also in research. Now, the proper judgment during decision making is based on our professional knowledge, the clinical and the pharmacy laws, and plus knowing other laws. That's why I talked about the penal code. You have to know the penal code very well, because the penal code stipulates the action to be taken in case you contravene the law. Because ignorance of the law is not a defense. Data gathered from other resources, information collected from patient assessment, time available, expertise, collaboration with other healthcare professionals, and your communication skills. What are the steps in decision making? Because we have to identify the issue or the dilemma, need to gather relevant information. This will include both legal, professional, or clinical guidance. Consider the range of options available and what can I do. What are the risks and benefits of each option. Make reasonable decision based on evidence gathered. Make a record of both the final decision and the facts that inform the decision. And of course, as so many changes, you need to review the decision you made earlier. So what is, of course, in decision making, we have to ensure that we follow the ethics, must adhere to our standard. But however, not always you should adhere to the standard. It is critical that individuals work flexible with colleagues across different disciplines and sectors, sometimes beyond traditional professional boundaries, to ensure the best realistic outcomes for the patient. Don't be rigid. In case something can't work, can you find boundaries beyond our professional standards to ensure that the patient gets the best out of the services? Remember, our first role, our first code of conduct is our patient should be our first priority. Now, of course, ethical dilemma. This is a situation in which there is a choice between two or more actions, and this is common in pharmacies. May also occur when a problem or conflict exists between ethical principles. And while handling the ethical dilemma, ensure you refer to your professional knowledge, code of conduct, penal code, or any other pharmacy laws. I keep insisting about the penal code. Ensure you read the penal code. Of course, ethical dilemmas only mention a few. We have dispensing dilemmas, like for example, narcotics, dispensing without a prescription, sale of medicines, contraception, healthcare dilemmas, and This is this. Healthcare dilemma, this is almost the same. Healthcare dilemma. For example, we have fellow professionals who are drug addicts. Someone is taking pethidine, is taking tramadol like nothing. Are you supposed to tell? You're supposed to. It's a dilemma. If you tell, you're controlling relationship. But if you don't, you're causing more problems or more harm. And there are very many ethical dilemmas. I only mentioned a few. You can contact us in case you have more or you want more. These are other presentations about ethics and law that we shall be talking about. Thank you for listening to me and watching the presentation. That is me, Wilson. This presentation has been brought to you by M-Pharma Training Solutions. Subscribe to our channel, M-Pharma Training Solutions. Like the video, leave a comment on how we can improve, and thank you very much.